Let's see. So nothing's, we have 18 participants, so people are. Good morning. Hi, everyone. Welcome. Good morning. Thank you for being here. We apologize for the delay. We had a small glitch with our Zoom webinar link, but we're back. I'm just going to give a few folks a little bit of time to settle in. Meanwhile, I'm just going to say some welcoming remarks and just get us started, some basic housekeeping items. So good morning, Oregon State Representatives and staff. Thank you so much for joining us today. We have over 17 folks signed up for today, so we're really excited. We hope that you have your coffee or your tea in hand. We know this is an early morning meeting. So again, we really are appreciative that you're starting your morning with us. Sit back and we hope you're ready to learn a little bit about our Oregon COVID-19 farm worker study. We are going to talk to you about our preliminary study findings, and then we're going to, I'm going to pass the mic over to our colleagues and talk a little bit about policy recommendations, and they'll be providing some testimony. So we'll start our meeting today with the brief description of the survey. The Oregon COFS Policy Action Committee will also share policy recommendations that provide immediate attention to maintain farm worker safety, as well as maintaining their well-being at home. Then after that, we're going to switch to a 30-minute Q&A discussion portion of this webinar. And we're going to be joined by a panel of scholars, along with several community leaders that are part of the survey. And then we're going to end up with a brief, we're going to stick around for the remainder of the remaining 15 minutes to answer any questions that y'all might have. So more seminar style. So settle in. Again, honorable Oregon State representatives and staff, thank you for being here today. Thank you for joining us. We welcome everyone. And again, we're just gonna give you some quick briefings. I apologize if you're hearing me repeating myself, but I see people still joining. So I'm just trying to give them an update. So this morning, we would like to start first by thanking you for being here. I also want to thank Marta Sonato from Pacun for organizing this briefing. My name is Jennifer Martinez. I'm a public affairs and policy doctoral candidate at Portland State University. My pronouns are she, her, ella. And I served as the project's organizer / facilitator. So I'm really happy that you're here to listen and to learn more about our extremely collaborative project with over 11 on-the-ground community-based partners and policy advocates. And so we're really excited to brief you on our preliminary findings from this first phase of the study. Right now, you are all muted, but we welcome your comments and questions. You can submit your questions by hitting the Q&A button at the bottom of your screen. And we'll have a Q&A session after our briefing. If you have any technical difficulties, please feel free to use the chat feature and we'll be able to help you. If you also just want to use the chat feature to introduce yourself, that would be great, just to get a sense of who's in the room. So just again, a brief overview of our flow of the conversation today. The majority of our time together will be spent hearing the preliminary findings of our study. Then I'm going to pass the mic over to our community partners who will give testimony, and they'll also provide policy recommendations for you all to consider. And then we're going to transition to that Q&A discussion, and we're going to feature scholars from around Oregon, including Lynn Stevens from the University of Oregon, Ron Mize from Oregon State University. And we'll also have some community leaders there, like Ubaldo Hernandez from Comunidades Columbia Riverkeepers, Peter Hanley from Casa de Oregon, and Valentin Sanchez from Oregon Law Center. And of course, Marta Sonato from Pacun, Farmworker, and Latinx Working Families United. So now what I'm gonna do is I'm gonna just briefly introduce the project to you and the study that we did over the spring and into the end of summer and now fall. So this is a tri-state effort that extended from California, Oregon, and into Washington. And so this effort was ignited really as a response to an overwhelming portion of the Latinx and Indigenous people working in agriculture experiencing disproportionately higher rates of COVID-19 than other folks from other ethnic backgrounds and industries. So we know that with the wildfires experienced here in Oregon, our concerning preliminary studies will only become more bleak. And so just kind of to set the stage, as you all know, Oregon's Health Authority's COVID-19 weekly report continues to highlight food, packing, and agricultural work sites as uniquely vulnerable to the spread of the virus. But we don't have a clear picture of how COVID-19 has spread across Oregon's 174,000 farm workers outside of those outbreaks that we hear in the news. So the current reporting system only discloses workplaces with more than 5 incidents that have at least 30 people employed that are actually counted. So we hope this brief sort of helps us connect the dots and give you the tools to provide an informed response. So now I'm going to talk a little bit about the survey. Again, this is a 2-phase study. The first phase was a survey of 300 farm workers, and we'll soon be moving into phase 2, which will be a more qualitative approach. So we're going to be talking more in depth with farm workers to see how COVID-19 has impacted their lives. So just really quick high details about the survey. I'm going to share my screen here, if I can. So just 1 second while I share my screen. Okay. We have some cool slides. Can everyone see my screen right now?
Yeah, they're loading.
Okay. So while it's loading, my internet's a little slow. I just want to thank, I see several of you all saying hi in the chat. Thank you so much for being here, senators. We really appreciate it. Okay, it looks like they're up now. So just again, just want to give you a high-level brief of our preliminary findings and of our survey. So first off, we sort of titled this survey COVID-19 Farm Worker Study, or COFS. And so, as I mentioned to you, this is an extremely collaborative project. We have several researchers and sponsors and partners, and you could see that full list there. And what was really important about the study in terms of its design is that we work through farm worker community-based organizations that already serve farm worker farm workers. And so that allowed for farm workers to really have that trust and tell us, right, how COVID-19 is impacting them. And we had a range of questions that had to do with on the work site, impacts, but also transportation. We talked about, support, a relief, and use of support. We talked about housing, access to health care, and of course other topics like mental health and food, inability to pay for housing or associated costs with COVID. And so the reason why we were able to ask them so many important topics is because there was established trust, right, within the networks that we work through. So as just really quick, this is 2 phases, as I mentioned before. We work through CBOs. The next phase will be doing qualitative, a more qualitative approach to the second phase of the study. And so again, we're going to give you results on the preliminary results. That's 200, a little over 200 surveys that we're basing our preliminary results on. Our full goal is 300. We are like 10 surveys shy from reaching the 300. So after we're done with that, we will give another supplementary brief with the final findings. But as you can see here in this map, this is how the preliminary results are distributed across the state. And here are some of our community-based partners listed that actually did the surveys. So before I dive into the actual results, I did want to tell you a little bit about design, right? This is a convenient sample. It's not a random sample of the entire agricultural population here in Oregon. But by allocating the interviews with geographic regions that have based on the share of labor demand between June and August, we think this is a good faith effort to really include, get a representative sample of agricultural workers. And so we did work through our networks. As I mentioned, it was a snowball sample technique. And so really quick on survey representation, 85% of farm workers that we interviewed worked on the farm, so on a farm. 39% of them worked with the contractor and 46% of them worked with the grower. 9% of farm workers worked with the fresh packer, and 4% worked with forestry and support services, and then 2% in our preliminary findings worked in the seafood industry. In terms of demographic considerations, our sample did lean a little, did overrepresent women. 58% of our respondents were women and 42% were men. The median age in our sample is 40. 71% were under 35, and 29% were over 40. I'm sorry, over 36. In terms of indigeneity, we had several partners that worked with us to make sure that we were representing Indigenous farm workers. And so we're really proud of that our sample represents 25% Indigenous farm workers. In terms of time in the US, right, we know in Oregon, a lot of farm workers pass through here following the crop. But in this sample, we actually have 67% of our sample that has lived in here or in the U.S. for 15 years or more. So this is a settled sample. So first and foremost, what our survey, one of our preliminary findings is that COVID-19 has created economic losses, right? And so farm workers told us that they lost months and weeks of wages. And so what we're really kind of hinting at here, what we really found is that agriculture is working, right? It's changing, it's evolving. The type of jobs that it offers is becoming more limited, more temporary. And we really saw that come through in the comments and in the surveys we heard from folks. So farm workers experienced significant loss of work and income during the pandemic. And this has really resulted in broader economic challenges. And one important thing too that I want to note is that the loss of income does have gendered impacts. When we asked women how much time they lost or if they lost any time during COVID, they told us they lost months, whereas men told us that they lost weeks. So it's really important to remember that, you know, this is not all across all genders, that you know, economic losses do have gendered impacts. And so we also asked, you know, what are these economic challenges that are occurring? And so as you could see here, we have a graph of where people are struggling to make ends meet, to pay bills, right? So people are facing food insecurity right now. They're having trouble paying rent. They're having trouble paying gas and electric. Utilities like water, and childcare is also another theme that came up. Unexpectedly, car insurance and car-related expenses is also another cost that farm workers are having trouble paying right now. And we disaggregated the information by indigeneity. And as you could see, for Indigenous farm workers, food insecurity is more intensified, as is rent and gas and electric. So that is also something important to take a note of. So now I'm going to shift a little bit to in the workplace. We also asked farm workers about how they're doing in the workplace. And so despite these economic challenges that farm workers are facing, they're telling us that they are committed to, you know, not being infected by COVID. When PPE and masks are available, they're taking all the necessary precautions at home and in the workplace to minimize their exposure. So not only are people changing their practices in the workplace, like washing their hands more often, wearing a mask, changing their clothes before greeting their family, but they're also, something interesting that we found is that they're also changing the way they commute to work. So here in Oregon, or farm workers tend to sometimes use the raitero system, right? So a collective ride system. Well, in our survey, we found that people were changing that way that they travel to work. And so a lot of people were saying that now they were taking their own vehicles. And that has created some unique vulnerabilities for those folks that do not have their own vehicle. And so now I'm gonna move forward. Another thing is that although farm workers are telling us that their employers have taken, steps to minimize exposure, they did tell us that there are periods of times during the workday where they lack appropriate protective equipment and cannot socially distance. And that we heard from folks like that worked in the flowers, and a lot of times with flower sorting, they work on a band, right, that moves really quickly. And so one farm worker told us that they have to work closely with their coworkers because otherwise the flow of the job requires them, right? Otherwise they get behind. And so people told us that, they can't socially distance because of those type of structures of the workflows and because of meetings and things like that. Another important thing that we found is that COVID is still ravaging its path among farm workers. Farm workers already know people infected or they've already been directly exposed, and few of them report getting tested. And a reason for that that we heard often is because they have, first is the cost, not only from losing wages because they have to quarantine or whatever it might be, or just not being able to go to work, but also costs associated with medical attention. But another important piece here was fear. People were scared to lose their jobs if they had COVID. And so fear was also a significant barrier to accessing testing and care. And so overall, only 37% of farm workers told us that they've gotten tested for COVID-19. And 34% of them told us that they know a coworker or that had been infected, and 20% said that they knew someone in their household or someone in their household had already been infected. And so this is just another graph to barriers to medical attention. As I mentioned, cost of care was a big barrier, as was loss of wages, but really fear of losing the job. Those two barriers seem to be most pronounced. And there's, again, when we disaggregate the information by indigeneity, we see that these two components are intensified. And then when farm workers do get COVID, or they are thinking of what they would do if they had COVID, a few of them have the means to quarantine or isolate if someone in their household gets sick. Not only because most farm workers might live in an apartment or they might share their housing, but also overall, we heard from farm workers that they really don't have a plan if they had COVID, if they were to contract COVID-19. And so 1/2 or more of farm workers surveyed remain unaware of paid sick leave benefits and existing relief funds organized by the federal government and the state of Oregon. So Oregon was very proactive in terms of creating relief funds for farm workers, for those folks that we knew were excluded from the CARES Act. But there's still, many of them still don't know that these funds exist. Same thing with sick and family leave. Folks don't know that they have a right to this. And as you could see in the graph, this is also pronounced more among Indigenous farm workers. And so I'm almost getting to the end, and I'm going to pass the mic soon. Another preliminary finding we wanted to tell you about is that farm workers that speak Indigenous languages face additional information and accessibility gaps. And we know that that's not only Indigenous farm workers, that's across, right? Indigenous people that live here in Oregon. And so something that we found as well in a supplemental research project that Lynn Stevens and Oregon Law Center did is that they found that Oregon Indigenous farm workers speak at least 22 different languages. And I think that number is actually 23, not 22. And those Indigenous languages are only for Mexico and Guatemala. So we have a wide range of languages that are spoken here in Oregon. Farm workers also have trouble assessing affordable childcare and supporting their children's education with the shift to remote classes. And so all those 79% of farm workers that we interviewed have children under their care. Only 8% of them actually put them in a child care center. So most of them they rely on extensive network of family, their children, their older children to take care of their kids. And that has created some unique challenges for farm worker children, right, that are older. They're taking on a lot more responsibility. So here you can see a quote that says, "My 15-year-old son takes care of his little brothers and does not have time to himself as before due to COVID. This makes him a little angry or stressed or depressed about being at home with this responsibility." So that's something that we heard often from farm workers, that they're worried about their children, especially their older children. A lot of their older children, they have to balance school, they have to balance working because they need to support the household income, and they are also now taking care of their siblings or taking on more responsibilities at home. And farm workers are feeling stress, right? Their emotional well-being is being impacted, and most of them don't have access to mental health care. So 27% of farm workers told us that they feel scared or they have fear. 27% of them told us that they feel depressed. And many of them are feeling these effects in the body. So 19% of farm workers told us that they were already experiencing migraines. And so we know that, that the question of mental health is a tabooed subject among farm worker communities. So this is probably the results at best. And as I mentioned, 91% of farm workers told us that they don't have access to mental health care since COVID-19 began. And then finally, farm workers, they have extensive networks. They don't only put food on our table, they don't only take care of their family, but they're also supporting their families back home. And so farm workers still continue to worry greatly about their family members outside of the US. And the pandemic has resulted in a significant reduction in remittances sent to families in Mexico and Guatemala who depend on them. And so many of them express regret that they couldn't continue sending. So with that, that is just a preliminary, really quick takeaway of our preliminary findings. There's still a lot more, right, that we need to do some more analysis on, but this is something that we wanted to leave you with. So now I'm gonna pass the mic on over to my colleague, Kathy Morales from UNETES, Center for Farm Worker Advocacy, and she's gonna give us a little testimony on wildfires and how they're adding an additional layer of complexity.
Hi everyone, good morning, buenos dias. I'm Kathy Kazee, she, hers from UNETE Center for Farm Worker Advocacy. UNETE began in 1996 and is a farm worker and immigrants' rights organization located in Medford. And in our county, Jackson County, the Latinx population makes up about 13% of the total population, so kind of mimics the state levels. So during COVID, we've been providing WRAP services to families in quarantine or people with positive COVID. So we're providing food or resource information. And we reached out to about 270 Latino individuals since August. So total positive COVID cases in Jackson County in the Latinx community around 48%. So although only representing 13% of the population, so this is pretty much replicating what we're seeing across the state and nation in terms of COVID infections. So as we are doing intakes for the families, we're finding that there are a lot that are ag workers. I don't have an exact percentage, but at least half. So through that outreach to the families, what we found in the hemp and the marijuana workers were that the foreman told them that if they had any types of symptoms or demonstrating any type of COVID symptoms, that they weren't to report their symptoms to anyone and just to continue working, or they could just stay home until they felt better. So they were also being threatened that they'd be fired or that they wouldn't pay them if they did report. So understandably, there was a real reluctance by these workers to divulge their names and locations of the farms and things where they were working at. And so that made contact tracing difficult. And so on top of the threats due to like the tight working conditions they were in, they were also unable to practice social distancing. So unsurprisingly, we saw a lot of positive COVID cases stemming from hemp and the medicinal herb farms. So down here, not news to anyone now, but on September 8th, there were fires that absolutely tore through the south end of our valley. and there were over 2,500 homes now that were destroyed, including 12 of the trailer parks in the Phoenix Talent area. The local school district there estimates that over 45% of their students are now homeless, and one of the elementary schools even projects that at 65% of their students are now homeless. So what happened with the fires was essentially wiped out the main sources of affordable housing in our areas. And again, many of the families were low wage earners, and many of whom were ag workers. So these fires forced people into evacuation centers and other forms of congregate living. And we've heard of as many as 19 people in one home, which was about 3 or 4 families with several young children, and as many as 11 in hotel rooms. So again, being unable to practice social distancing, no surprise now, we are seeing like record numbers of new COVID cases in our county, and we're getting 4 or 5 families a day now to provide wrap services for. So on September 10th, the winds kind of died down in the valley, and the valley filled up with smoke. And so at this point, the air quality was rated some of the worst in the world. So there were several labor camps that had to evacuate during the fires, and fortunately, no lives were lost, but there were other consequences from the smoke. So there were workers whose camps had lost power and water, so they were forced to bathe in a stream that's close to their camp, which is essentially irrigation water. So this is water that runs through fields where there's livestock, and so we can only imagine what they were exposed to in terms of bacteria and pesticides. And again, these same workers, these ones who had to bathe in this stream, were also in quarantine because there was a positive COVID case with a coworker. So not only were they at an evacuation center, but they were also still supposedly in quarantine, but still working. So one day at the evacuation center, we went out there several days to try and do intakes and see what folks were needing. I noticed that some of the workers out there had masks that weren't rated for smoke, and you could tell that the masks had been used all day at work. So the workers said that the masks were given to them by the growers, but they were not rated for smoke. And just want to add that there were masks available, free PPE for growers here in the Valley that they just had to pick up. So I'm unclear as to why those weren't being distributed to the workers. So workers were transported generally in school buses, so with open windows due to the heat. It was pretty hot at that time as well, so they were exposed to smoke to and from work, as well as issues with being able to distance in the buses for COVID. And they work in the smoke all day, essentially, with the masks that aren't rated for smoke, and their masks are dirty and just from the nature of their work, sweaty. So basically that renders the mask useless. And so then they returned home to their cabins. There's no air conditioning or even fans in some cases, so they have to open the windows and doors to cool the rooms down because, again, it was hot. And at some of the sites, even the cooking facilities are outdoors. So they're constantly being exposed to this high levels of smoke and poor air quality. So not only are they at risk of increased risk of COVID, but they're also being exposed to this unhealthy air quality in all aspects of their housing and their employment. So finally, just this last week, the smoke finally left the valley and air quality levels are pretty much back to normal, but who knows what that potential impact has been on workers. So I just want to thank you again for inviting UNITE to be part of this panel. And we ask you, our state representatives and staff, to please remember our essential workers, those that feed our state, and keep this agricultural industry strong and alive in legislative action that positively benefits their employment, their health, and their safety, and that of their families. Thank you.
Thank you so much, Kathy. Now I'm going to hand the mic over to Rosie Andalon from Casa of Oregon.
Hi, sorry, this is actually going to be Peter talking.
Oh, I'm sorry. Yes, Peter Hanley from Casa of Oregon.
Thanks, Jenny, and thanks, Rosie. So Casa of Oregon has been doing farmworker housing development around the state in partnership with local organizations, including the Housing Authority down in Jackson County. One of the affordable farmworker housing projects that we built in Talent a number of years ago was completely destroyed in the fire. We're also recognizing that mobile home parks are a big housing option for farm workers. And what we're seeing is that a large number of farm workers have been displaced because of those fires down in Southern Oregon. Now, we don't know exactly how many, and CASA intends to conduct a survey down there and try to get a better grasp on what the impacts of the fires were. But we do know that they were substantial, as Kathy was mentioning earlier. What we know is that farm workers have traditionally lived in crowded, overcrowded, and unsanitary conditions. And we would like to see that the legislature take some action in the upcoming session. The governor is considering expansion of the farm worker tax credits, and the farm worker tax credits have long been used as a source of funding for affordable housing. And so we're hoping that an expansion of those tax credits will provide some additional housing opportunities. CASA also works to help residents in existing mobile home parks to convert them to resident ownership. And while we are going to begin with an analysis of the housing needs of farm workers, our work down in Southern Oregon will likely undertake the impacts of the loss of the manufactured housing stock in the area as well. One of the things that we would like to see is some funding provided directly to culturally specific partners that help organize farm workers to advocate for themselves. I think UNITE does a fabulous job down in Southern Oregon, and I think a lot of these organizations are under-resourced and could use some assistance in helping them to provide the assistance that needs to happen out there. We'd also like to urge the legislature at an upcoming e-board to consider a Project Turnkey, which is a collaboration of Association of Oregon Counties, League of Oregon Cities, as well as the Oregon Community Foundation and other local partners to purchase hotels and motels to use as a way to quarantine and help folks isolate, at least in the short term for COVID-related issues, but then as permanent supportive housing in the longer term. And so we'll be coming to you with a number of ways to address the housing needs of farm workers in this upcoming legislation, and look forward to having continued conversations with you. So thank you very much for attending today.
Thank you so much, Peter. Now I'm going to pass the mic on over to Anabel Hernandez Mejia from Farmworker Housing Development Corporation.
All right. Thank you, Rosie and Peter. Yes, my name is Anabel Hernandez Mejia. I am a resident leadership coordinator. So I do work a lot resident services and directly with our residents here, farm workers and low income, all of them. So FHDC, Farm Worker Housing Development Corporation, we're located in Woodburn, mostly serve Marion and Polk counties. We're hoping to expand soon to Lebanon. But one of the things we experienced here with the farm workers were the difficulties and the issues with testing. So with that, because again, some of the connections and the strong relationships we've been able to build with the residents, we were able to, and as well as our partners, we were able to have one of our partners go and, along with the help of our promotoras, go door to door to do testing. At the same time, even though we had slightly above average results on the testing from what the survey overall was, we still encountered many residents that did not or feared taking the test because they thought when they put the swab in that they were actually putting the virus in them, or if they felt fine, that they didn't want to find out or be given the news that they were positive because they felt fine. And so there was a lot of disinformation. We did utilize that at moments to be able to discuss and be able to inform residents on obviously the correct information. However, there was still fear, and even for those that did take the test to be responsible, and even if they didn't have symptoms, when they went back to work, they were met with patrones who would then ask them, well, if you took a test, it probably means you might have it, and they were asking or requiring a second test that came out negative. And again, these are, even though tests were negative to begin with, they were requesting a second test. And that second test, though, was going to cost them $120 at least to go and get it done. And they were also having issues going into some of the local medical clinics that they normally go to and getting the test done if they did not have any symptoms. So those that really quickly made it difficult for them to go back to work, even though, again, they were fine. They were just being tested to be responsible in case they were asymptomatic. And they were being met with loss of income, loss of work. And again, the way residents work and communicate is they get a lot of information from their neighbors, the people that they know and trust, and that is the information they go with. So one of the reasons why I really appreciate some of what Peter was saying is, yes, a lot of the residents, and for much of what Jennifer has mentioned too, the people that we were able to survey are mostly people we already have some connections with. And because of those connections, we're able to connect them to those resources. And we are still definitely missing a lot of people out there that are probably not as fortunate in being able to have those connections. And going back with the tests, for those that did come out positive, it was very difficult to isolate. So obviously here in FHEC, we do have apartment complexes, and we are able to ask or somehow try to meet, have them reserve a room for one family member who was COVID positive, and the rest of the house or apartment be for the rest of the family. However, for a 2-bedroom, 1-bathroom apartment, it was very difficult to not have shared space. And then, of course, people outside, from that are not in these apartment complexes, whether it be Bienestar, FHDC, or some of the other ones, they live in apartment complexes where it's a family per room, or in houses where, again, there's multiple families in there. And we did get to hear about families that got sick, where it was, again, extended family living in the same house, and everybody in the house ended up getting sick. And 2 of the elders actually had to be hospitalized for 2 months to again, due to COVID. And these were people that did not believe in it, were still going out and working. And come to find out, they were then caught, once they were getting better and had some contact with promotoras, were saying, you know what, you're doing the correct thing, take care, protect yourself. And so it's one of those things where also, and I'm shifting a little bit for past COVID, for those that did come out positive with COVID, some of the things that we started then noticing too is, even if they, as a whole family, had to end up being isolated, once they got out of COVID, they were starting to get out into the community again without wearing masks. So again, that disinformation, or that lack of information of, again, what are the risks that they are taking, and having enough capacity to be able to educate them more on that one-on-one, and again, doing it through those reliable people or connections where they already trust, and it's easy for them to open up and be more accepting of that information.
Thank you so much, Annabelle. Appreciate your testimony. Yeah, and one of our policy recommendations is to provide frequent and extensive access to COVID-19 testing with convenient access to lab results and vaccinations once they're available as well, so that we can ensure that, farm workers, we're also thinking of that framework needed in the future as these vaccines start coming out. Next, I'm going to pass the mic on over to Antonio Garcia from Centro Cultural de Washington County, and he's going to talk a little bit about strengthening Oregon OSHA's occupational safety enforcement. So over to you, Antonio.
Hi everyone, my name is Antonio. I'm representing Centro Cultural that serves Washington County, and one of the main policies recommendations that we picked up and we want to sort of like bring out through the survey, strengthening Oregon OSHA occupational safety enforcement and worksite auditing activities. And this is because throughout most of the surveys that I've taken here in Washington County, I've seen that a lot of the people are not informed as far as masks go and the safety of them. Many of them have surgical masks, which do protect against COVID, but they don't protect against smoke and other other factors that might be hurtful to them. And social distancing is very well talked about, but not necessarily enforced. Has been many uh, like sightings in the survey of people telling me where they cannot socially distance because their job doesn't allow for it, either be through blueberry picking or through the field or through their job, what they do every day. So then about 28% of farm workers surveyed report fear of losing their job if diagnosed with COVID-19. And this can lead to many other like factors of not keeping the work site safe and OSHA type of regulations, because the way that OSHA works is they mainly rely on complaints to make different inspections that are actually permitted, and they don't really rely on the random inspection method, which is what we really want to get across, because most of these sites, they tend to get one up over OSHA, and they start cleaning and they start making everything feel better, make everyone feel better and keep all the facilities clean as soon as an OSHA inspection is going to come around, which has happened and I have seen in the survey. And then after that, a lot of the agricultural workers always report that there's usually pretty disgusting and not safe conditions in bathrooms unless that OSHA is going to come around. So they all kind of get excited when that happens, which is something that should not be happening. So that's the main thing we wanted. That's one of the main policies that I wanted to enforce out of this survey, and that we wanted to enforce out of this survey, which is strengthening OSHA. And so is there anything else? Shoot. So yeah, I think that's the main thing I got from it, and I'll pass it back to Jennifer.
Thank you so much, Antonio. Really appreciate that. And, making that point that if, enforcement is based on complaints, we hear that a lot of farm workers are fearful of even filing a complaint. So that does make unique challenges. So now I'm going to pass over the mic to Marta Sonato from Pacun, and she's going to talk a little bit about some of the work that they've been doing to support some of this fear that we know exists among farm workers.
Thank you, Jenny, and good morning to everybody. Thanks for joining us in this early morning meeting on this wonderful Friday morning. My name is Marta Sonato, and I'm the political director at Pacun, Oregon's Farm Worker Union. Since our founding at Pacun, we fought for workplace rights for our farm workers since the 1980s. And at that time, 80 farm workers got together because they wanted to address the rampant abuse that was happening in the workplace. And that's how they were able to form Pacun, which stands for Pineros y Campesinos Unidos del Noroeste. And I think a lot of my colleagues here have, described a lot of the challenges that our farm workers have always faced and continue to face at an even increased rate because of COVID and the fires. And over the years, our farm worker communities have been part of the fight to ensure that our state has important victories, such as raising wages, earning sick leave, and safer working conditions that ultimately protect everybody, and especially our most vulnerable workers, such as our farm workers. So before COVID, and now even more during COVID, the disparities that our farm workers are facing have become more stark. Everything from unhealthy workplaces, such as being exposed to toxic pesticides like chlorpyrifos, or pollution, such as breathing in diesel exhaust. They are also the ones that are directly feeling the impacts of climate change, breathing in all the smoke from the fires that were raging in our communities just a couple of weeks ago. Also experience other significant challenges such as wage theft, like working through breaks or off the clock, intimidation and verbal abuse of immigrant workers, and also experience sexual harassment and assault on work sites. And so at Pacun, we've been working a lot at the advocacy policy level to work for a lot of these important victories that I just mentioned. Unfortunately, there is much more to do. We still continue to hear many stories from our farm workers, how they are experiencing all of these all of these situations that I just explained. And now even more with COVID, we've actually had, you know, groups of farm workers reach out to us through the phone and asking us to do something about their working conditions because, you know, their employers aren't following the law, or they aren't being provided with a lot of this really important PPE that they need in order to feel safe at work. And so one of the things that they've told us about is about enforcing workplace protections. And there's a lot of, there's really not a lot of trust from our farm workers towards our agencies, because we often hear the phrase, no hacen nada, they don't do anything to protect us. And so that really, you know, focuses on the issue of enforcement, that we have all of these important labor policies and just workplace rights that, you know, there's a lot of good actors out there, a lot of good employers that are following the law, and there are some that are not. And in Oregon, we know that we can enforce workplace protections that ensure farm workers can take time off and or file employer complaints without fear of retribution. And this looks like supporting whistleblower protections and also abolishing farm labor collective bargaining restrictions. Whistleblower protections have the potential to revolutionize enforcement of workers' rights in Oregon, especially for farm workers. The problem that this policy and, you know, potential law aims to solve is weak enforcement of basic workplace protections in Oregon due to inadequate funding for a lot of our agencies. And that this will be actually more exponentially worse by expected budget shortfalls across agencies. This impacts agricultural workers and low-wage workers most. Once again, there are a lot of laws that we have on the books that a lot of our communities, a lot of our legislators in today's, you know, webinar have worked really hard to pass. But at the moment, our agencies, because of budget cuts across over the last couple of years and expected cuts in the near future, they are unable to provide for, you know, the adequate enforcement capacity of those rights. And so a whistleblower protection policy would empower workers to become whistleblowers and enforce their rights. In conclusion, you know, a whistleblower law or policy that we're definitely planning to work on in the next 2021 legislative session will give workers the right to step into the shoes of the state to enforce the law on their own if the state is unable or really unwilling to take action. And it can allow one worker or really a community of workers as well to bring a claim forward for all affected workers without having to name each one individually. And this is extremely important because it'll protect, you know, it protects those that are afraid to come forward. As you all heard, there's a lot of fear in the community, you know, not because of immigration status, folks don't know their rights, just a lot of different barriers. And so additionally, you know, another thing that we've heard from the community, especially, I mean, from farm workers, is that they're not able to collectively bargain and for, you know, healthier workplaces and higher salaries. And that is a huge, you know, employee power imbalance, that they're not able to do that a little bit more. And so that is something that is also a concern for our communities, for our farm workers, and something that they would like to change in the near future as well. All right, thank you, Jenny. I'll pass it back to you.
Thank you so much, Marta, for that testimony and really just, you know, that information. Now I'm going to pass the mic over to Valentin Sanchez from Oregon Law Center, and he'll talk a little bit more about indigenous farm workers specifically, language justice, and access to relief funds. So over to you, Valentin.
Nani Valentin Sanchez, Centro de Leyes de Oregon. My name is Valentin Sanchez, and I work as a community outreach worker with the Oregon Law Center's Farm Worker Program. I am a Mixteco indigenous language speaker and a former farm worker as well. My pronouns are he, him, él. I want to start out by just thanking you for your time and your for your interest on the issues that impacts our farm worker population. I also want to thank Martha for organizing this virtual event, and Jennifer for the tremendous work she has been doing over the past few months, bringing us all together and keeping us on track. But I want to especially thank all the farm workers that were involved in responding the survey questions. I believe that it would take us approximately 60 to 75 minutes going through all the questions, and just keeping in mind that they're extremely busy with work and family members. So I want to thank them for their time answering the survey questions. The Oregon Law Center's Farm Worker Program provides information, resources, referrals, and legal representation on employment-related issues, from unpaid wages to discrimination. I also want to take a moment and answer one of the questions that was posed in the chat box. Oregon is home to 170,000 farm workers, including family members. Within the farm worker population, we have farm workers who speak indigenous languages from Mexico, Guatemala, and other Latin America countries. Indigenous languages don't have a resemblance to Spanish. Indigenous languages are not dialects of Spanish. And through the work of many, we have documented at least 23 different indigenous languages spoken here in the state of Oregon, including Mixteco, Zapoteco, Tumam, and Canjoval from Guatemala as well. Now I would like to speak specifically about 3 policy recommendations. The first policy recommendation is to mandate employers to provide training when it's not already required by the law in languages farm workers speak, including indigenous languages. We also need to have improve language accessibility of information, guidance, and rules that are enforced by our various state agencies. It is also important to allocate resources to our local navigators who can connect and inform farm workers who speak indigenous languages about resources and provide them with referrals to other types of services. And the second policy recommendation is to ease barriers, for farm workers to exercise their rights by connecting them to legal assistance, where they can receive legal advice, and including, from workplace rights, tenant rights, concerns over public charge, and immigrant rights. As a preliminary finding, shows, many people don't know about employment protection and assistance, whether it's through state or local community organizations. And finally, the third policy recommendation is to replenish income and safety net supports for farm workers regardless of their legal status, such as the Workers Relief Fund, the COVID-19 Farm Worker Rental Relief Fund, and expand qualifications for the Oregon Quarantine Fund as well. One farm worker told me the other day that a day worth of wages is the difference whether she could pay rent or not. So, it has been, having a huge, it has been a huge assistance for people to count on these type of, assistances. And I'd just like to conclude by saying the farm workers have been facing many challenges for a really, really long time. With COVID-19 and the wildfires, those challenges have only been exacerbated. So this preliminary finding is just a bold reminder, of the work ahead of us to protect our essential farm workers. And we need to protect them not only, through the pandemic, but also post COVID-19. So with that, I'll send it back to Jennifer. Thank you so much.
Thank you, Valentin, for that testimony and those policy recommendations. Just really quickly, I do want to mention we have one more speaker, but before we get there, I do also want to let you know that you could submit your questions via the Q&A box at the bottom of your screen or your chat. We're going to try to get to all of your questions, and if we can't, we're more than happy to connect with you afterwards. But now I want to pass it on over to Lynn Steven from University of Oregon. So over to you, Lynn.
Thank you, Jenny. Thank you all for being here. And also thanks to Jenny and Martha for arranging this, and to my amazing co-worker team and all the work that we've been doing. I'm a professor of anthropology at the University of Oregon. I've been in Oregon for about 20 years, and I've been doing research with indigenous folks in Mexico, Guatemala, indigenous farm workers in California and Oregon during that time, and have published on those topics. I participated in the survey, and one of the things I did was interview recent mom immigrant agricultural workers. And one of the things I think that really comes through when we hear all these testimonies is the diversity in the farm worker population. There are differences by how long people have been here. There are differences in terms of ethnicity and language, as Valentin so eloquently detailed. And there are age differences and gender differences. The other thing we see is that we have to think of farm workers as whole people. Because people use the labor farm worker, we often tend to focus only on labor. But in fact, like all of us, farm workers are caretakers, they're parents, they're children, they have extended families in other countries, and they're struggling to integrate all the things that a lot of people are. But most of them have to leave home to work. And in interviewing recent mom indigenous immigrants from Guatemala, who I also work with as an expert witness on asylum cases in Oregon for folks seeking asylum from Mexico and Guatemala, it's important to point out that people who are recent arrivals, largely undocumented, are not necessarily organized. So there are farm workers who are not yet in organizations, and we hope that we get there and we do outreach. So this particular population is not necessarily in community organizations, and I used connections I have through the work I've done asylum, and through, in a couple cases, other organizations. But these folks are very vulnerable. They're working in wineries, they're picking our berries, they're plucking salal out of our forests in the coastal range to put into flower arrangements. And they're also, in one case, harvesting pine cones that get sold and people use at Christmas time. So I want to just focus on a few of the recommendations. As Jenny mentioned, people have children at home, and this has fallen more on women, but women left the labor force in some cases to stay home to take care of kids, as did older children. And we'd like to actually advocate that because there's not access to childcare or childcare supports, these are essential workers. And for example, the YMCA in Eugene offered childcare for essential workers there where I live. These are essential workers. These are older siblings and women doing childcare for essential workers, but they're not getting subsidized care. They're not getting access. So we'd like to propose, in thinking about providing them compensation. And as long as we're in virtual school, people are also, these same people are supposed to be teaching their kids while managing these other things at home. We also found, I found in my conversations in the survey and analyzing the results, that there's a lack of access to digital technology, to even the internet and digital literacy. Because we're looking at folks who are greatly varied, but among the most vulnerable, who don't read and write in Spanish, may not speak Spanish, or understand some, and we're dealing with school systems trying to do outreach. So we need a higher level of intervention. We need access to smartphones, tablets, and stipends to offset internet, because the number of people I talk to, they don't have the internet in their house. And to add an internet bill of, or their apartment, $80, $100 a month is beyond their means. Finally, the other point is the weight, the accumulated weight that these folks are bearing, not only in terms of all these issues here, they're often in daily contact by WhatsApp, sometimes on the phone or FaceTiming with family members in Mexico and Guatemala. They are worried about the pandemic there. There have been lockdowns in a lot of places. I've been on the phone several times with folks that I work with in Huehuetenango from the same communities of the people, some of the folks in the survey. There's no public transportation, there's no work, people are not eating, and they're talking about that with folks here who've been sending remittances but can send less. So not only are they dealing with the stress of what's going on in their, with their children here at work, trying to stay safe, they're also supporting folks in other countries. And this has really resulted in a great deal of stress. People are creative, they're resilient, they pray, they sing, they try to take their kids out, and do what they can, but they really don't have access to mental health services. And often, if there is access, it's not in the formats or the culturally appropriate ways that people are accustomed to. And there's a wide range of traditional medicine and conceptualizations of health is not separating the mind, the body, and the heart, but working with traditional methods as well as counseling and other forms of mental health. So we really feel like we need to step it up on that, and we need to get funds out to trusted clinics who will have the folks available to do that kind of support. Thanks.
Thank you so much, Lynn. And again, I just want to thank all of our wonderful panelists that were here today and provided testimony and talked about policy recommendations. I also want to thank all of their work. We started meeting in April, and so we've met so many times, and their time invested is the reason why we're able to be here today. And of course, we got to thank the farm workers that lent their time and were willing to talk about these issues with us. So now we're going to transition over to our Q&A section. I do see that there were some questions submitted via Q&A that have already been answered, but if there's anyone, any state representative, legislator that would like to talk and unmute themselves right now, I could definitely do that so that you could ask your question in person, or I guess in virtual person in your own voice. So if you want to do that, would you write down your name in the chat, and then I will go ahead and unmute you, and then you can ask your question to our panelists. We're in this discussion panel. We're going to be joined by Valentin Sanchez, Lynn Stevens, Ron Mice, who is our other scholar from Oregon State University that was really supportive throughout this whole effort, Ubaldo Hernandez from Comunidades, Peter Hanley from Casa of Oregon, and Marta Sonato from Pacun.
I think you can stop sharing your screen, maybe?
Yeah, and I'm going to stop sharing my screen now. For now, I'm going to go ahead and pick one of the questions that someone asked in the Q&A, and then we'll have one of our panelists, our discussion panel, address it. So there is my shared screen. I'll stop now. One question from Representative Dembro is, has the media been presented with this information? Yes, we had a press conference. I could answer that pretty quickly. We had a press conference a couple weeks ago, the 16th, if I'm not wrong, of last month. Maybe I am off a couple of weeks, but we did have a press conference a few weeks back, and we did, it was mostly a press conference, so we were prioritizing questions from the press, and that whole press conference is actually recorded and on our website at COVID-19 farmworkerstudy.org. And so you could see that there. I'm going to go ahead and choose another question from the Q&A box. Again, representatives, if you'd like me to unmute you and you could ask your question, I could do that too. Just let me know via chat that you'd like to be unmuted. But for now, I'm going to go to another question again from Representative Dembro, who asked, obviously you wouldn't want to ask about documentation status, but to what extent is that a factor in workers not asking for help? Same for concerns about public charge and fear of losing immigration status for requesting support. And I see that a few of our panelists already took an attempt to reply to that question. But how about I ask that question, Ubaldo, do you want to answer that? And so I'll just repeat the question. Representative Dembro asks, obviously you wouldn't want to ask about documentation status, but to what extent is that a factor in workers not asking for help? Same for concerns about public charge and fear of losing immigration status for requesting support.
Thank you, Jennifer, and thank you for that. That's an important question because there is a big part of our community that they have no documents, and that's something that is not really put in consideration when wanted to offer services to the community. And this is one of the issues that we have in our communities in Oregon, and especially in the farm working communities, where a lot of the farm workers, they are mixed families with different status. So we have a lot of those issues where a family, even part of the family, they have a documents and the other not, and they're afraid to ask for those services because they don't want to affect their families. So, and this is one of the issues that create a lot of crisis on our communities, and that regarding of accessing the services that they are there to help our families. And now, on another hand, there is a lot of families that they are having opportunity to resolve their documentation, and then they can't access to these services because they don't want to affect that. And we're just talking about how this affect the way of them to get a proper documentation eventually. The underlying of that is the effect that create on their families, on the health, on the emotional health, and that's really important that we are not seeing that much of that. So a lot of these families that they don't access to these services, those are families that they're missing a meal. They are not having money to provide proper tools for education to their kids. So proper transportation, proper healthcare. So all those, these regulations, they stop from these families to access to those services. So when we're talking about this issue of the documentation is something that really affects on the roots of the Latino families, because not being able to apply for those services or not allowing people to go ahead and feel confident that they can access to those services without affecting other members of the family, we are affecting the lives of their families and especially kids that they are growing up here. And they're not really having a proper care and opportunities to develop on our society.
Thank you so much, Ubaldo, for that answer. And yeah, I think you hit on all of those. To that question, or to add comments.
I guess I could just, really quickly interject that, the level of fear has, completely elevated. So there's a lot of fear, not only to seek assistance, like the Oregon Workers Relief Fund, but also fear of, invoking their rights as farm workers. But I will also add that, there's a lot of fear even for people who do have legal status, who are permanent residents, who hope to apply and become U.S. citizens. So there's a lot of fear the public charge would affect them down the road.
Yeah, I just wanted to add, I put this in the chat to the question, but these policies are created and targeted to individuals, but people live in families. And many, many people are in mixed status families. So there are US citizen children, people who are legal residents, and people who are undocumented living in the same household, taking care of each other. So that's another reason why people are hesitant to access resources, is making other people vulnerable, sharing information, name, address, phone number of people, and then the general climate and what people have already said. So I think that's question. It's really important to consider the families, the communities that people are in and how they're connected. It's not just an individual question.
Thank you so much for those answers. We have another question from Representative Brian Clem, who asked, can we hear a bit more about Project Turnkey? What are the limitations beyond funding? I recall some issues with the Woodburn City Council or mayor being unhappy with Marion County for acquiring a hotel, and wonder about discriminatory NIMBYism. So how about we give that question over to Peter?
Sure. So we became interested in Project Turnkey because for a number of years, we've looked at hotels and motels as good options for migrant and seasonal farm workers, and had looked at a number of them along 99E. So when this project came up, and we also had worked with Catholic Charities to try and develop a new motel in Canby. And so, this concept we've been very interested in for some time. Some of the limitations beyond funding, which is, I think a big limitation, obviously the capital to acquire and then the capital to operate. I think it's the ownership, it's the operation, and it's providing services. Representative Clem, I think down in your area, Mid-Willamette Valley Community Action has been looking at this for some time, as they've been providing vouchers for a while. And so they're very interested in this concept. And so from what I understand, you're going to have NIMBYism no matter what. I mean, we have NIMBYism on pretty much every farm worker project that we've ever developed around the state. And so I think that piece is nearly impossible to avoid, though with an established use of transient use, I think this is an ideal way to serve this population. And I'm looking forward to working with some of our community partners and with the legislature to make it a reality.
Thank you so much. Go ahead.
I just saw Senator Dembrow's comment about the e-board considering some funding. And that indeed is true, that will be coming before the e-board next week. So I know there's probably a couple members on this call or staff. So if you could encourage folks. Now this project is obviously further along in some places than in others. And so some of the initial projects might not specifically serve farm workers, but I think if we can get some of these going, I think we can really prove the concept. So.
Anyone else on the panel want to add to that answer? Thank you so much, Peter. Okay. Oh, Annabelle?
And this is something I spoke with Representative Clem with about maybe 2 years ago now in one of the lobby days for housing. But again, also having funding for, for example, resident services, that was the topic at that time, where we do have people, and sometimes they do qualify. And for example, in that case, it was a mother who had a daughter and needed to get support. And she did qualify actually and did have status. However, again, the not knowing how to read and navigate the system, and again, the language barriers made it very difficult for them. So it's not always in only the funding, but also being able to provide that funding for that support and wraparound services so that they are able to get that guidance information. And again, coming from someone that ends up building those relationships and trusts with the community.
Thank you so much for that, Annabelle. I do see a comment here from Jason Trombley, who says, Rep. Kenny Geyer told me that the hope is for the e-board to include Project Turnkey on the agenda for the 23rd. And Representative Kenny Geyer and or Rep. Marsh will find out answers to Rep. Clem's question and we'll follow up. So thank you so much for that answer, Jason.
I forgot to mention that Rep. Kenny Geyer and Rep. Marsh were key leaders when I was initially talking about Project Turnkey. They were two legislators that were really pushing the concept. So I apologize for not acknowledging them when I first mentioned the project.
And just a reminder, you could go ahead and add more questions in the Q&A or in the chat box and we'll answer them. But for now, I wanted to go back to one of Representative Dembro's questions. And it's, as of last week, Latinx Oregonians are nearly 6 times more likely to contract COVID than whites, and 3 times more likely to be hospitalized for it. So any comments on that that our panel would like to add or say? Annabelle.
One of the things I'll share is that, again, a lot of the immigrants coming in back home, there's a huge distrust in the government institutions and agencies. So when they come here, this is when you end up having those issues. For example, back in Medford, when the fires go through and burn down the home, the life savings were right underneath the mattress. It's not, they don't have them in a bank. They don't trust, again, there's a bank's officials when they tell them, you know, the testing, different things like that. And I know OHAs has been doing a lot of extensive work in trying to reach out and again, provide information. However, again, there's a huge distrust in organizations, institutions that come out from those formal backgrounds. And that is something that is in part cultural, again, just because of what they've experienced and what has been their ancestors back home and just the government, the way, again, the situation is there. And so that sentiment is carried over here, and it ends up being portrayed in the same way, where when we're trying to provide this information, depending again on who it's coming from, they're gonna be already distrustful of it. And I'm sure Valentin or even Martha might wanna chime in and add more to that as well.
Thank you so much, Annabelle. Marta or Valentin, would you want to add to the comment that Latinx Oregonians are more or nearly 6 times more likely to contract COVID-19 and what that means for our communities?
I guess I'm trying to look at not only the symptoms, but also at the root cause. You know, why is it that we're seeing this significant number of COVID-19 in our communities? And, you know, I think it illustrates that we need to look at our entire system at the state and local level and, you know, try to create a system that it's going to work, right? And so I think we need not only OHA, but also, you know, the Bureau of Labor and Industries to inform people about the sick leave options, laws. We also need Oregon OSHA to conduct more in-person inspections to really figure out what's happening in the various outbreaks that we've been seeing throughout the state. And, you know, we also need to create language accessibility that really works for our entire community. So that's just something that I think it is crucial for us to continue to brainstorm and try to figure out how can we develop a system that works for everyone, not only during the pandemic, but post, you know, COVID-19, in case, you know, we have future pandemics, in case we have a natural disaster, you know, how are we gonna respond? How are we gonna recover and ensure that everybody is in that process as well?
Yeah, I think the only thing I would add, and I think those are all, that's all right? It's about looking at the root causes, and it's also no secret that a lot of members of our community work in essential industries. And so agriculture is definitely one of the hardest hit. And we just heard a case, right, recently up on the coast with the seafood company where more than 70 employees were infected with COVID. And, you know, I think in that particular case, I have heard firsthand, I can, you know, say from the chats that some employers just blamed that on the workers. And I think that is a huge issue that I heard, because it doesn't only come from the home, right? We, like, folks are exposed to COVID everywhere they go. And so in the workplace, there's a responsibility as well from the employers to ensure that that workers are protected as much as they should be and can be. And so, you know, it really points to why we really need strong rules as well, coming from OSHA around infectious diseases, strong rules from OSHA around, you know, agricultural labor housing. So the agricultural rules will be expiring here pretty soon, and they primarily covered field sanitation, transportation, and labor housing. And there was a huge like limitation there that unfortunately labor housing isn't going to be, you know, covered in the infectious diseases rules. And so so yeah, there's definitely a lot more work to be done, and really looking at the root cause. To really appreciate Valentin's and Annabelle's comments because they hit right on the nail.
Also, I would like to comment on the, sorry, Lynn, do you want to
I just wanted to follow up with one point, which is not only infection rates now, but thinking ahead to vaccinations, which is something that Annabelle raised when she talked, that all of these structural, linguistic work, all these barriers that we see to testing, that we see to quarantining, etc., they're all there for vaccinations too. And I think that's, I just wanted to point that out, thinking forward.
So one of the things that I would like to talk is about the personal, the PPE, personal protection equipment. And what we need to do is to really analyze if the equipment that is provided to workers is the right equipment. And as a person that's been doing work, farming work, or working on farms, the masks are not really providing the match protection, especially when we are working on trees, picking fruit, and moving really fast, and being able to breathe, be on the trees and branches. And this mask is not properly fit on your face. It will fail, it will hold down. And talking to farm workers on this time when the crisis on the smoke, they were talking about that was useless, even if they get the proper mask for smoke, because they say that if they couldn't breathe, then the smoke even goes inside the mask, because it's not their job required for them to move a lot, so it's not just standing, so it's not appropriate equipment. And that's what happened also working on the packing houses. A lot of the equipment is not a proper equipment to protect the workers, and that's one of the reasons that we have those problems. The other thing is there is a lot of regulations from what I heard from packing house workers, that they said when OSHA is coming to check and they put a lot of regulations, at that moment the packing house follows those while they are there. But when they're leaving, it's another story. And the other thing, when somebody calls OSHA because they don't feel safe and they feel like those regulations are not followed, OSHA is coming to visit the site, but they give a notice, 3 days notice. So it's a time for them to work on that. And when they show up, all those rules are followed. So it's one of the reasons that's why there is a lot of exposure from our farm workers, packing house workers, the Latino community, which are the largest community working on this industry. That's where we are getting more exposed and having more cases of COVID because of that.
We have about 3 more minutes left. Ron, I wanted to open space to see if you wanted to add anything to any of the questions. Mm-hmm.
No, so very quickly, just to follow up with Ubaldo, then I think it's one of the things that our survey found that I don't want to minimize because we're telling other stories as well, but the vast majority of the folks that we have interviewed, if they're given the equipment, they use it. If they have a sanitation station to wash their hands, they use it. I mean, all of the protections that farm workers are willing to do, they're doing if it's available to them. So it's about a matter of making sure that it's available to them. And I think it's good. That goes the same with COVID testing. That goes the same with relief funds. If it's available to them and they're knowledgeable about it, and it's in a language that they can understand, then the reality is that those services will be provided and they'll be utilized. Peter, I know you had your hand up. Do you want to add one piece too?
Well, I've just, in my 28 years of doing farm worker housing and watching kind of the evolution of, at least in the housing projects that we've developed, folks are employed more by labor contractors than by, the employers. And, the contractor issue has always kind of been a conundrum for me. And I don't know if anybody's got the answer, and maybe this is a question for phase two, but that issue of, is there enforcement issues on the labor contractors, whether it's through BOLI or OSHA or somewhere else, but have folks given some thoughts to what we might try and do with maybe the issues of bad actors being in the contracting area?
So I would say that in many instances, farm labor contractors and employers are also joint employers. I'm not going to say that it's in all, occasions, but both have responsibilities under the law to protect people. But yes, we're being seen an increasing number of farm labor contractors. I believe in the state we have approximately 400 registered farm labor contractors on that list.
I do want to also quickly just point out that in our survey, a lot of farm workers are increasingly going through personnel agencies. So that is another way that farm workers are getting through, not really even a FLC, a formal farm labor contractor, but these personnel agencies, right? Day laborers type of arrangements. With that, we're at 9:30, but does anyone else want to add to that before we lift off? Okay, thank you again.
I just want to say something just to close this. When we're talking about services to the community and access to it and right to access those services, please have in consideration that undocumented immigrants pay taxes too. And we pay about 7 billion per year to the country on taxes. So have in consideration that a lot of the services these undocumented people cannot access because their status, they still paying those taxes. Thank you.
Yeah, and then we have one more quick question, and I know you all are still here, so if you want to bear with us. Representative Brian Clem said, I know the 20 million for the Oregon Worker Relief Fund is already exhausted. Do we know if there's any in the 30 million provided for the ag industry left? I can check with the Legislative Fiscal Office if we don't know. Does anyone have an answer to that?
I can speak to a portion of those 30 million. So 10 million of that went to the quarantine fund, which is specifically for agricultural workers that have come in contact with someone that has COVID or have tested COVID for COVID-19 themselves, and they need to quarantine. And so they're eligible for up to 3 weeks of financial relief. And also if they are once again, if they once again come across COVID and they need to quarantine themselves, they're able to apply for that fund. One of the things that we have found, though, is that because it's very specific to farm workers, the outreach that we have to do is very different. And it's similar and it's different, right? And so we've been pushing out a lot of information in indigenous languages. However, there's still a lot more outreach that we can do, and we've been partnering up with OHA as well. They've been working with a lot of CBOs across the state to get information out to the community. So we still have definitely money in that fund. For the Oregon Worker Relief Fund, right now we are in conversations about more funding. We've been doing our own private fundraising as well. Have been, securing funds from several cities, several businesses, as well as foundations. So we continue to fundraise, and we still have a hefty goal to continue, pushing out money to the community. And hopefully we are able to, deliver more good news in the next couple of weeks.
Thank you so much. Yes, and that was one of our findings, right? That there's still a need out there for farm workers, and these are the farm workers that told us that are connected to these community organizations, right? And some of them didn't know about the fund, and that's not because of bad, outreach. That this is at its best, and so we need to support community-based organizations to continue that outreach, as well as replenish those worker relief funds and quarantine funds. So with that, we're available to brief your offices if you need it. We're not going anywhere. We're going on to phase 2. So if you have any ideas of what you would want to see in phase 2, feel free to email me or get in contact with Marta or whoever you'd like to connect with most easily. Yeah, and we'll continue this conversation. Again, really appreciative of all of our panelists, all of our discussants, and to you for being here today this morning. And so with that, it's already 9:34. So thank you so much. Have a great rest of your day.
Thank you, everybody.
Thank you all.